Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department says Metro Manila is back at high-risk classification as COVID-19 cases steadily increase. How are hospitals coping and gearing up against the Delta variant? Philippine General Hospital spokesperson Dr. Jonas Del Rosario and St. Luke's Chief Medical Officer and Vice President Dr. Benjamin Campomanes join us live. And later, we'll also look at Cebu hospitals now being overwhelmed by COVID-19 patients. After months of being at low risk, the Health Department says Metro Manila is back at high risk level due to rising cases. The DOH says the Delta variant is driving the current surge, and a declaration of a community transmission is inevitable. The government is now expanding healthcare capacity, hiring more health workers, ramping up vaccinations to prevent hospitals from being swamped. Let's go straight to the source of the story. First off, Philippine General Hospital spokesperson Dr. Jonas Del Rosario. Dr. Del Rosario, welcome to the source, and thank you so much for your time, doctor. Dr. Del Rosario, can you hear me, sir?
Good morning. Good, Pinky, you're coming in erratically. Good morning. Thank you for having us.
Thank you for your time. Dr. Jonas, I hope you can hear me now. First, I wanted to find out what is the situation right now at PGH.
We are seeing a significant increase in our admissions, comparing it about 2 weeks ago when we only have about 100 COVID patients. After about 2 weeks, we are now up to 154, and there are patients waiting to be admitted and also waiting to be transferred from other hospitals. Our ICU is 90% full, and we're also seeing more pediatric COVID cases.
That's a lot that you mentioned. You said that right now you have about 150 patients and still some are waiting to be admitted. Bakit po naghihintay pa na ma-admit sila?
Some of them are severely or critically ill, and the issue is we do not have ICU beds for them. We're trying to make arrangements, waiting for some of our ICU patients to get discharged. Some of them have special needs. But I think it's just a matter of time. All of them will come in once we can accommodate them. We have about 225 beds for COVID. Out of those 225, about 40 beds are really for ICU or ICU setup.
Okay, so ilan po yung severe and critical? Am I understanding this right? That are needing hospital beds right now and still waiting?
When I was talking to the head of the transfer command center of PGH, she texted me the list. There are about 10 patients who are critically ill. They needed a ventilator. They're waiting to be transferred to PGH. These are patients who are coming from the hospitals. At the same time, we also have patients who are severely ill coming from their households or from the LGU. So we're trying to prioritize those who are not yet in the hospital. That's probably one of the reasons why we cannot admit some of these patients waiting in the wings. As to the classification, I don't have the exact number, Pinky, but as you know, since PGH is a COVID referral center, most of our patients are severely ill. I would say safely at least about half of our patients out of those 154 right now are in the severe, and maybe about 20 are critically ill.
Do you still have ICU beds available right now, Dr. Jonas?
In the adult ICU, we have barely enough already. Because we can only give about 40 for the ICU, the adult ICU. We have about 8 beds for the pediatric ICU. So for yesterday when we were looking at the census, it's almost like 90% full for the adult ICU. So konti na lang po natitira, siguro 5 or 6, and so we're really quite choosy because some of our patients also in PGH, some of them, let's say, came in as moderate, and then eventually their diseases can progress to severe to critical. So we also need some buffer for some of our patients. Now, what happens sometimes is when the ICU is already full, we have to transform, let's say, a regular bed or a ward to an ICU setup, just to give this kind of type of management, because some of patients cannot be admitted to the ICU anymore because, just like what we said, the patients are still there and trying to recover.
How many patients are waiting for ICU beds right now? Because if you have 5 beds available left in the ICU, I want to know ilan pa po ang naghihintay waiting to be admitted para po sa ICU dyan sa PGH?
Doon sa when I say waiting to be admitted, that means they are either in a hospital who wanted to transfer their patients. There are about 5 dun po sa nakalista, and then dun sa iba naman po na nasa bahay pa, another close to 10 na severely ill na dapat ay ma-admit din if ever sa ICU setup po ng PGH.
Then you have about 15 more or less waiting, aside from your moderate patients that might need to be transferred to the ICU. That's why you have a buffer of that 5 ICU beds still available right now.
Right. But Pinky, usually those buffer beds eventually nagagamit na rin yan eh.
Yun na nga po.
And that's why hindi naman pwedeng there are patients waiting and then you're still reserving those beds. No, sometimes talagang kung sino na lang mauna at sino talaga yung mas nangangailangan, so they end up getting those beds.
I'm basically understanding, Dr. Jonas, puno na po yung ICU ninyo, because even if you have 5 beds left right now, you have moderates that might need the ICU beds, and you have 15 others waiting na makapasok po sa PGH. Tama ho ba yun?
Yes, that is
Needless to say, puno na po kayo.
The patients listed in the transfer command center. Tama. You know, when because a lot of our patients who come into PGH are actually, they need oxygen to begin with. No, otherwise we try to ask them to go to if they're mild only and they're not really oxygen requiring, let's say high flow oxygen or even just a regular oxygen, that these patients might end up going to the ICU or at least have an ICU setup.
Right.
And most of the patients now being referred to PGH are these types.
Opo. Doon sa 150 patients that you have right now, Dr. Jonas, ilan ho ang Delta cases?
Hinihintay pa po namin yung sasabihin ng Philippine Genome Center. About a week ago, a little bit over a week, there were 21 confirmed Delta cases from PGH. About 8 of them are actually admitted. The rest were taken care of as outpatients. No? So they came in for our swab, pero 8 po doon. Out of the 8, 2 died and 6 recovered. Now, we continuously send samples to the Philippine Genome Center. Unfortunately, the turnaround time is not that great. We have to wait. So we don't know exactly how many right now out of this 150 patients are Delta. And so the presumption is, and this is our general rule, we assume that everybody who is admitted to PGH right now, they are presumed to have the Delta variant.
Okay, let's talk about, kanina kasi Dr. Jonas, sinabi niyo po, may pediatric beds din po. Tama ho ba? What is the situation there?
Yes po, we do cater to pediatric COVID cases. We actually allocated 8 beds for them, and the setup also, we made it like an ICU, like a pediatric ICU, because a lot of these kids are sick, and so there has to be a ventilator or high flow oxygen. So out of the 8 beds, 7 are occupied right now. 3 are intubated. The rest are oxygen requiring. I was told by the pediatric intensivist that they're seeing sicker pediatric patients now with COVID, severe COVID pneumonia, needing intubation.
And this is not something you've seen in the past, sir? Is this relatively new, yung mga nakikita niyong pediatric patients?
Well, we did admit pediatric COVID cases in the past. It just seems to us that they're sicker now.
And when you mean sicker, what exactly have you seen?
Well, when we made sicker, they have severe pneumonia and need to be intubated. No, some of our pediatric patients have underlying comorbid conditions. As you know, PGH is a multi-specialty referral hospital. So some of our patients, let's say with congenital heart defects, kidney problems, lung disease, they also get sick. And when they do develop or acquire COVID, they're at risk. They are at risk.
Let's discuss the profile of the 150 patients, Dr. Jonas. Would you know if they are vaccinated individuals or not? We're losing Dr. Jonas Del Rosario of the Philippine General Hospital. We're trying to find out gaano kapuno na ang ospital dyan sa PGH. And technically, really, he's saying that even if meron pang 4 o 5 ICU beds available, marami na pong naghihintay, possibly from their moderate cases that are in admission right now. And according to Jonas, meron pang at least 15 na naghihintay na maipasok sa PGH. I wanted to actually find out from Dr. Del Rosario, ano ba yung profile, especially ng mga patients na pinasok, yung 150 currently right now, if they are vaccinated or not. But right now, we still do not have him on the line. Okay, he's been disconnected. On that note, I'd like to thank the spokesperson of the Philippine General Hospital, Dr. Jonas Del Rosario. We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Let's now talk to St. Luke's Chief Medical Officer and Vice President, Dr. Benjamin Campomanes. Dr. Campomanes, welcome to The Source. And also, maraming salamat po sa inyong oras. Let me begin. I want to find out first a situation in St. Luke's, Quezon City. Please tell us, and then please go ahead and tell us the situation in St. Luke's BGC.
Hi, good morning, Pinky. So, actually, I just want to do a cumulative and a combined report. For a perspective, in July 20, this is a combined number of both Global and Quezon City. This is July 20, we had 13 patients admitted to the ICU. We have 35 beds, ICU beds, and we have 55 COVID patients out of 198 beds. This was July 20. So we look at August 4, which is today, we have now 27 patients out of 35 ICU beds and 149 COVID patients in the wards out of 198 beds. So that will be an average of 40% increase within a 2-week period.
Okay, let's look at the numbers that you had just mentioned. 27 patients, cumulative po ito, both Quezon City and BGC. So meron po kayong 27 patients and you have a total of 27 patients out of 35 ICU
35.
beds. That means,
Yes, correct.
yes, that means you only have 8 beds left sa ICU in
Correct.
both BGC and
Correct.
Quezon City.
Yes.
Are there people waiting, sir? Meron ho ba mga
Sorry?
pasyenteng naghihintay
No,
are there patients already waiting to be admitted to the ICU?
Now, none waiting. We have
Okay.
all admitted them in the ICUs.
So let's talk about the ward that you had mentioned a while ago, Dr. Campomanes. 149
Yes.
in your ward out of, I believe what you said, 150?
198.
198, sorry. So that's
Yes.
you have about still 50 beds available.
Yes. So basically 77% of our ICU beds are occupied and 75% of our general nursing units or wards are occupied.
What kind and how can you explain to us what you've seen last week compared to this week, from 2 weeks ago to now?
Yeah, so as you mentioned earlier, there is really a steady increase. And you can see within a 2-week period from 37 and 27% for ICU and general nursing units to 77 and 75%. So there's really a steady increase within a 2-week period.
How is your emergency room? Are you still accepting patients sa ER, sir?
Yes, we are accepting. We are still accepting in the emergency room. And also our non-COVID patients, we have separated our ERs. So we have our normal non-COVID patients are still coming in.
Mm-mm. Dr. Campomanes, is this concerning to you, the numbers that you're seeing from 2 weeks back to what it is right now?
Sorry, I didn't get that.
Is this concerning, doctor, for you, that
Oh, yeah.
considering the numbers
Very
that you are
much.
seeing?
Yeah, before July 20, we would have, numbers running from just about 20 to 30 on both hospitals. And this was going on for about 2 weeks. We thought that would be steady. And suddenly there is as you mentioned earlier, a steady increase up to the numbers we have today.
The number of available beds that you have, especially in your ward, which is about 50, are you estimating how much longer it will take before mapuno po yung dalawang ospital at mapuno po yung inyong ER?
Yeah, well, considering the steady increase, if this does not hold, with our ECQ, then within a week, we expect that this will be full.
What are you doing in both St. Luke's? Are you already planning to expand the ward and the ICU beds? I spoke to Undersecretary Maria Rosario Vergara yesterday, and there was, of course, this appeal to public hospitals to increase their bed capacity to 50% and the private hospitals to 30%. Where are you in terms of increasing bed capacity?
As of now, it's 30%. We're open for 30%, not the 50% yet. So we're
you are ready?
hopefully we don't have to increase by 20%.
Pero handa po ang St. Luke's to increase to 50% if need be.
Yes. We are ready for that, and we will open for 50 is already ready, and including the manpower.
Good. That's good to hear. Dr. Campomanes, tell us more about the profile of the patients being admitted now in both St. Luke's. Are they more critical?
Yes.
Are they younger? What kind of symptoms?
Yeah. They are definitely younger. We're seeing people in their late 30s to 50s. And I would think that this would comprise the unvaccinated or had only the first dose. Remember, these are patients or profile of patients not in the A1 to A4 group. They will be the younger patients, and these patients will be the ones that are not vaccinated. So there are some elderly who come in. We call the breakthroughs. It means they're fully vaccinated, but they still become critically ill. as we still look at hospitalization of people with comorbidities, especially obese, diabetic, hypertensive. Those are the people that will crash. So those are basically the profiles of our patients that come here.
Thank you for that, Doctor. But is there a some sort of determination already among the patients that have been admitted, the 150 right now, if they have been vaccinated or not? Do you have a number that you can share with us?
I don't have the exact number, but I just got a word from our infectious people that most of these people are really unvaccinated or only had one vaccine. As I mentioned earlier, because they are not in the priority or the tiering group, they're not in the A1 to A4. So these are the ones that will have the infection.
As I was asking you a while ago, is there anything different about this variant now? I mean, if we were just, are you, number one, is St. Luke's considering that these are Delta variants? Meron na hubang assumption na yung mga pumapasok ay mga Delta cases?
Yes, well, the same as with PGH, we assume that all patients coming into our hospital now are all Delta. That is the assumption. We don't have the numbers, but we rely on the Genome Center to give us the data on that one. They're quite limited because I heard they can only check about 750 patients per week. So it's rather slow. So we just have to assume that all the patients coming in are Delta cases.
That's right. They can genome sequence about 750 per week. In fact, the Philippine Genome Center is also asking that there be offices likewise in Visayas and Mindanao because all the samples, even from Luzon, Visayas, and Mindanao, are being brought to them. Doctor, yun pong, so right now, yung sinasabi po ninyong kahit papano there's still availability na mapuno po ito in 1 week. Ang sabi niyo, you're ready to increase and that you have the staff for this. Do you have issues? Does St. Luke's, both BGC and Quezon City, have issues with settlements with PhilHealth?
Yeah, definitely. The PhilHealth, we have accounts receivable from PhilHealth close to 2 billion. So that's a big amount of money. And if we were just a small hospital, I'm sure we would have folded up. So that's a big amount of accounts receivable from PhilHealth.
Did you say 2 billion?
Yes, close to 2 billion. Correct.
Since when?
Sorry?
Since when yung unpaid bills of PhilHealth?
Since the beginning of the pandemic. And this has been accumulating. That's why we're also scared about COVID again, because then we know that more of these accounts receivable will go up. Because then, like all critical and severely ill patients, will get at least most of them will have about 700,000 that is receivable from PhilHealth, which is we're not getting paid for it anyway.
I think it's Senator Grace Poe recently, if I'm not mistaken, who said who is calling on PhilHealth to pay the yung kanilang mga utang sa mga hospitals. We'll try to talk to her also about this in the coming days. Just very quickly, Dr. Campomanes, how are your healthcare workers?
I think we're of course giving our healthcare workers additional hazard pay, and that's a big thing for all the healthcare workers here. There has been some money coming in from the government for our healthcare workers.
Okay. Any of them have gotten sick because of the increase in patients? Let's say in the past 2 weeks, nung tumaas po yung nag-increase po yung patients' admission on COVID. Have any of them gotten infected?
We've had community infections, close to 300 for the 2 hospitals. But what is interesting is that because all of us are vaccinated, that none of them have been critically ill or severely ill. So showing that the vaccines do work. They're usually mild to asymptomatic. They're all vaccinated. So
Thank
it
you.
means the aim of the vaccine is, of course, for you not to get hospitalized, no critical disease, and no severe disease. So in that aspect, we think that the vaccine is working very well for us.
That's good news to hear, Dr. Campomanes. And thank you so much for your time. St. Luke's Chief Medical Officer and Vice President, Dr. Benjamin Campomanes. Thank you, sir. And coming up, it's now beyond challenging for COVID-19 patients to find a bed in Cebu hospitals. Let's get the latest situation from the province after the break. And let's get the latest from Cebu province. Our Cebu-based correspondent Dale Israel is with us. Dale, kamusta?
Yes, Pinky, at least 78 people died here in Cebu City last July due to COVID-19. That's according to the data from the Cebu City Emergency Operations Center. With the detection of highly contagious Delta variant, the entire Cebu Island, which includes Cebu Province, Cebu City, Mandawi City, and Lapu-Lapu City, they recorded about 18 to as much as 28 new deaths in a day in the past 5 days. City officials admit main cemeteries are full and bodies are piling up in funeral parlors. Cebu City's health and local authorities already met with owners of funeral homes to address the issue. Now, those who died of COVID-19 are being prioritized for cremation. Officials say the rising number of COVID-19 deaths resulted in the lack of burial spaces in the 6 major cemeteries in Cebu City's urban district. Now, residents are now being given the option to, bury their dead in the cemeteries located in the mountain barangays where there are still ample spaces. Back to you, Pinky.
Dale, just very quickly, can you tell us the situation in the hospitals if you have any data?
Yes, Pinky. New cases are still being recorded here in Cebu City, but and also in the entire province as well. We visited one hospital last week and over the weekend, and we saw, several ambulances and private vehicles outside these facilities with patients next to oxygen tanks. Now, the health department or regional office said the situation has already been addressed as more and more hospital beds have been opened and some of the patients were referred to other hospitals. But according to a frontline medical worker that we talked to last night, he said that the hospital or their hospital is still full and ambulances are still waiting, like around 7 ambulances are waiting with patients to be admitted. Pinky?
Okay, thanks a lot, Dale Israel. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.